Hi everyone, good to see you again all. I hope you all will be fine. Please subscribe my channel for more latest updates. The top COVID-19 hotspots in the U.S. These are the counties with the highest recent rates of new COVID-19 hospital admissions per capita. COVID-19 hospitalization rates in the U.S. have continued to rise week over week, based on data from the Centers for Disease Control and Prevention. The U.S. tallied about 15,000 reported hospitalizations of people with COVID-19 over the 7 days ending August 19. Though a far cry from previous totals during the pandemic, that's a 19% increase from the week prior, continuing a climb that started at the end of June after hospitalizations reached a recent weekly low point of approximately 6,300. Relative to population, the latest tally equates to 4.5 people per 100,000 admitted to the hospital. By state, Hawaii and Florida saw the highest rates of new COVID-19 hospitalizations, at 9.8 and 9.7 per 100,000, respectively, more than twice the national rate. Among patients visiting emergency departments, 1.9% were diagnosed with COVID-19 nationally. Hawaii and the southeastern states of Mississippi, Florida, Alabama and Louisiana saw shares higher than 3%. 7 counties were described by the CDC as having a high level of COVID-19 hospital admissions, with rates at 20 per 100,000 or higher. Several counties in Mississippi, Noxubee, Lowndes, and Clay, as well as Lamar County, Alabama, were reported to have seen 26.4 new hospitalizations per 100,000 people. Another 117 counties were said to have a medium level of COVID-19 hospital admissions, with rates between 10.0 and 19.9 per 100,000 people. Notably, the CDC's county hospital admission figures are calculated at the health service area level, which can span multiple counties. This means counties within the same HSA will share the same admission rates in the data. Because hospitalization rates are calculated per 100,000 people, it's worth noting that even a relatively small number of hospitalizations in a small community can lead to a higher hospitalization rate. Other measures also can give a sense of the current state of COVID-19. Though the CDC has ceased publishing a community-level metric that incorporated COVID-19 case rates and hospital admissions, as well as the average percentage of hospital beds occupied by COVID-19 patients, health departments can submit the results of their sampling of wastewater for the virus to the CDC via the National Wastewater Surveillance System. Since the U.S. passed 1 million cumulative deaths tied to COVID-19 in the spring of 2022, more than 138,000 additional people have died in connection with the disease, according to provisional data from the CDC. While the latest tallies are down from a recent peak of about 3,900 deaths in a week in January, and well below the maximum peak of around 26,000 deaths per week in early 2021, data indicates hundreds of people have died in connection with COVID-19 of late. Maryland and Florida each saw 3.4% of their total deaths attributed to COVID-19 during the week ending August 19, doubling the national percentage. Thanks, take care.